Hello, my name is Dr. Nick. Welcome back to our series regarding the most common run-in related injuries. Here we're on number 4, which is medial tibial stress syndrome, or more commonly known as shin splints. As always, don't forget to like and subscribe and share this video to someone who may need it. For the sake of the video, I'm going to use the most common term that people refer this as, which is shin splints, but it's got a couple different names. Shin splints is the one we're most familiar with. Medial tibial stress syndrome, that's I'll break down each of those words in a bit. And then the other, most complex word is traction periositis. So basically, what does that mean? Shin splints is basically a traction pulling type injury along the bone, which is caused by an overuse of the muscles in the front of the shin. Now, we've said this for probably all of our injuries that we've talked about so far, but this is the big one when we're looking at an increased running volume compared to what's normal. This is especially true if you've not been running before. So this is a really common thing that we will see in our newer runners. What do we look for in this? Now this can be on one leg or it can be on both. We're looking at pain along the inside portion or right in the front of the shin, so the lower leg. And this is also something that's pretty key. You're going to see the pain actually lessen as you warm up. So as the blood flow comes into that area, but as you run and you go further distances, that's when your pain is going to worsen. Who is going to develop shin splints? So you're going to see someone with a higher BMI, which means that since there's more stress going through the leg with running, you're going to have more stress through that area, obviously. And then you're also going to have abnormal running mechanics. So your running is going to be off a little bit. So what do we look for in our gait mechanics? Well, again, one of the biggest things to look for is overstriding. So taking much longer steps than you need to. And then the other two things we look for kind of go hand in hand. You might see someone have a more narrow running base, and they're also going to have prolonged what we call pronation, so that movement inside of the foot where your foot accepts weight. What does that mean? Well, if you're spending more time on the foot in this position, you're going to have more stress. Simple enough. So what do we do for shin splints? Well, the first thing that I'm going to suggest is to obviously reduce the running volume. You take the stress away or you reduce the mileage, you're going to have less stress and things will recover a little bit quicker. Now, while you're running, one of the big things to do is to increase the cadence. Like we've talked about this before, but when you're increasing your cadence, you're taking more steps, which means you're spending less time on that foot. That's hurting. So when you're spending less time, there's less stress, less pain. So you could still run at least a little bit. Now, contrary to what you may see on the internet as well, doing 1,000 tib raises with your butt against the wall and lifting your toes up is not going to prevent shin splints, unfortunately. What is going to help, however, is a gradual return to running and strengthening around the area. Now, could you do tib raises? Sure. Could it be helpful? Yeah, it could. No, but it's not. But one exercise by itself is usually never enough to fully prevent an injury or to make things completely better. In our last video, we talked about foot strengthening and working the intrinsics. This is another big one for shin splints that'll be helpful, which is working the intrinsics of the foot muscles. The key one muscle is abductor hallucis. So if you imagine this is your foot, abduction, that toe moves out to the side. So being able to splay those toes nice and wide is really going to help strengthen that muscle, prevent the fatigue. When that muscle fatigues, boom, we get that collapse and we get that increased pronation. What we know about working the foot intrinsics is that it's going to have a protective effect on those who have really high volume mileage weeks. So those people who might have shin splints. If you do some foot strengthening, it might help prevent that. Now, by itself, it may not entirely prevent injury, but you may recover much faster when you have that good foot strength than if you don't. So there's everything that you need to know about how to deal with shin splints. In our last video of the series, next week, we're going to talk about stress fractures. And don't forget to like, subscribe, share this video with someone who may need it. We'll see you next time.